Hello, everybody. It's James Marcum with another biblical prescription for life. Thank you for joining me. I realized recently that I probably needed to talk about sleep apnea. This is a very common condition. This is a chronic problem that many people have, so let's talk about this. The question I have for you is this: do you have sleep apnea? Let's break this down to the basics. We won't try to make this complicated, just the information you need. But before we do that, let's go to a biblical prescription, a biblical text, and that's Matthew 11, verse 28. This is one of my favorite texts in the entire Bible. This is Christ talking to me, Christ talking to you. Come to me, all ye who labor and are heavy laden, and I will give you rest. Come to me, be with me, worship me, experience me. All you that are heavy laden, those that are under a lot of stress, burdens of this world, and I have a gift for you, and that's rest. Well, sleep apnea has to do with resting as well, physical rest at night. So let's talk about this. We've seen more and more people with sleep apnea through the years, and a lot of it has to do with people gaining extra weight. But how might you know if you have sleep apnea? So what are some keys when a patient comes into my office that I say, oh, you might have sleep apnea? Let's look into that. So we'll talk about the symptoms first, some of the physiology, why it's important to make the diagnosis, how we diagnose it, and then how we treat it. So if a person has high blood pressure, I always screen for sleep apnea. And I can screen for this by asking them some questions. Are you tired a lot? Do you fall asleep during the daytime? Do you snore a lot? Do you gasp at night waking up? Another symptom I might ask them about is, do they have headaches in the morning? Are we having wild blood sugar changes if they're diabetic? Might you have a funny heart rhythm, skips, PVCs, atrial fibrillation? All these can be associated with sleep apnea. Another thing, are you having problems concentrating, problems with your memory, depression? Is your mouth dry a lot? Do you have a sore throat frequently? Are you restless at night a lot? These might be conditions or symptoms that would say you might have sleep apnea. Well, why is it important to diagnose sleep apnea? Well, if you think about it, when you don't rest well at night, all of the parts get tired. They can't rejuvenate itself. The brain can't consolidate memories. The GI tract just doesn't work as well. Things just don't rest. We can't rejuvenate the lymph system, the GI. All of this is affected when we don't get good rest at night. We were designed to rest. When we don't get rest, when we sort of snore, we don't get good oxygen, what happens is the oxygen level goes down in the body. And then when it goes down, your body just hits an alarm. And that alarm system makes the alarm chemicals, adrenaline, cortisol, inflammatory, wakes you up. So you start breathing again and get the oxygen up again. And you might not even wake up, be aware of this, but if this goes on and on, night after night, day after day, year after year, it causes lots of problems, including chronic inflammation, oxidation, the things that sort of age our bodies. And sooner or later, if it goes on, it's a risk factor. It's a risk factor for the heart. It can make the blood pressure go up. Whenever the blood pressure goes high, you're at a higher risk of heart attack. You're at a higher risk of stroke. When the oxygen levels change, you can be at higher levels for abnormal rhythms in the heart. So almost everyone that has abnormal rhythms, I assess them to see if they have sleep apnea. In the brain, memory issues, having problems concentrating, can have problems with mental health. People that have sleep apnea are more prone to accidents. So these are the risks. It can make your metabolism worse. You're more prone to get diabetes because the cortisol levels are high. It can affect the liver. It can affect your hormones. So it's a risk factor for many things, especially cardiovascular disease. So if we think we might have it, if you have the risk factors, how do we diagnose it? Well, the first thing I do is I just look at somebody, ask them these questions. I look to see if they might have a big neck, to see if they might have big tonsils or something that's obstructing their airways. That's a good thing to let them know. I look to see if their mucous membranes might be dry. Other things that I look for is fast heart rates, blood pressure, those type of things as well. But the way we really make the examination is by a sleep study. And that's a special study where you go in and they look at you while you're asleep. They look at your brain activity to see how your eye movement's doing, to see your oxygen levels, whether they go down, to see about your heart rate and breathing. They look at all these parameters. Now, some people can do it at home just by oximetry, and there's also a questionnaire that can be done, and that's called the Epworth, Epworth questionnaire. Then once this is diagnosed, then treatment begins. Sometimes the problem is there's two types of sleep apnea, obstructive and central. Obstructive means where there's some type of tissue usually. It doesn't relax. It blocks the airway, lowering the oxygen. A risk factor for this is having big, thick necks, obesity, large tonsils, those type of things. Then they have central sleep apnea, and this is where the brain doesn't work as well, and especially it affects the muscles of breathing. You don't breathe as well. So that's two different types of sleep apnea. The treatment, of course, first of all, if you're heavy, try to lose weight. Get in an exercise program. Don't sleep on your back, sleep on your side. Avoid alcohol or sedatives that make it even more prone to have sleep apnea. But universally, the treatment is a CPAP machine. Continuous positive airway pressure machine. Lots of people wear this that have sleep apnea, and they say, I feel great again. I can rest again. I get oxygen. I have energy once again. Now, some people that can't do this, they can also try oral appliances. There's different dentists that give you things that help put your jaw in a certain position to keep the airway open. Sometimes if it's an anatomical problem, they can actually do surgery on it. Of course, we want to make sure there's no medical problems that contribute, heart failure, thyroid, those type of things. So I just wanted to give you an overview and ask you to question, are you one that has sleep apnea? And if you are you having some of these risks? And what are you going to do about it? I advise you to either go see your doctor, get this evaluated, because this is something that can be treated very successfully with either a CPAP, weight loss, or one of these other modalities we talked about. So get the sleep apnea, whether it be obstructive or central, looked at, because rest for the body is very important. This will help you with physical rest, but what about spiritual rest? Remember that text? Matthew 11:28. Come to me, be with me, worship with me, experiencing me. Come to me, all ye that are under heavy laden and stress-related activities. That includes all of us. And God's going to give us that spiritual rest, which also has physiologic benefits. So we can get treatment for physical rest, and we can get treatment for spiritual rest, remembering that God is going to help you along your path for better health. So I hope this gives you a little bit of insight into sleep apnea. Think about it. I hope you don't have it, but if you do, it's time to think about treating it so we don't have some of these chronic problems, especially with our heart. But most importantly, continue in worship. Worship the Creator. This will lead to permanent healing and also open your eyes and help you have the power to make some lifestyle changes. So share this with your friends and neighbors. Give it a like. Go to our website, heartwiseministry.org, and visit it. And we'll be back soon with yet another biblical prescription for life.